Hi, my name is Monty Powell, and I'm on the executive board of MOASC. On behalf of my colleagues at MOASC, we're thrilled to have Dr. Daneng Lee be our Researcher of the Month for MOASC. Dr. Lee has accomplished a great deal and is already an international superstar in the area of hepatobiliary cancers and neuroendocrine tumors. I'm really delighted today to have him here to discuss some of his areas of research interest. Dan, welcome.
Yeah, thank you so much, Monty, and really honored to be the Researcher of the Month for MOASC and everything, and happy to discuss all the exciting things that are going on in our research areas.
Well, this is just a real quick rapid fire for our Twitter audience and our social media audience. Can you just give us a sense of what your most exciting area of research is currently?
Yeah, I think the most exciting area of research is really involved with liver cancer. I think we've really made rapid advances in the past 5 years specifically. Previously we only had one systemic therapy, sorafenib, and now these days we barely use sorafenib just because we've just really gone into the world of combination immunotherapy. So I'm really excited in terms of what the future holds in terms of how do we advance further in the realm of immunotherapy. And I think there's really kind of three different levels. We can certainly combine additional immune regulator agents with our immune checkpoint inhibitors that we have currently. So these are what's known as really kind of triplet therapy trials. So really building on the backbone of initial combination immunotherapy agents that we have. Secondly, it's really to look at kind of more novel mechanism of action. So, can we potentially investigate areas such as oncologic viruses, as well as cellular therapies. So really the next generation, I call, of immunotherapy modalities for liver cancer. And then finally, can we combine it with our older tools in terms of local regional therapies? So these are ways where we can either combine it with chemoembolization procedures or radioembolization procedures to really augment the response for patients that have liver cancer and combine it with our systemic therapy agents as well.
So interesting. And this is always the toughest question for individuals like yourself who have so many really exciting clinical trials. But if you had to pick one to highlight for our MOASC audience, what would it be?
Yeah, I think it's really looking at novel mechanism of action. I really think, cellular therapy moving into the realm of solid tumors is really an exciting area. And certainly, for us, in terms of liver cancer, this is really true. So we're looking at two primary targets, targeting liver cancers that are highly expressive of AFP, as well as expression of something that's called GPC3. And I think GPC3 is a very large target in liver cancers. And certainly we're using cellular therapies, whether it's autologous T-cell therapies or CAR T-cell therapies, to really kind of target these. So we have ongoing trials in early development and really want to see whether or not this is really the future path in terms of treating liver cancer.
Well, Dr. Lee, from the time you hit the door at City of Hope, I knew you were going to be a superstar, and that's truly manifesting. Congrats on being MOASC Researcher of the Month, and thank you to our MOASC audience for tuning in. Until next month, Monty Powell here. See you later.